Lots of things can go wrong with the heart and blood vessels. We have ways to effectively treat many of these issues. Cardiovascular disease is a term used to describe diseases of the heart or blood vessels. A common example is coronary heart disease. Coronary heart disease is when the arteries that supply the blood to the heart muscles, the coronary arteries, get blocked by layers of fatty material building up. This causes the arteries to become narrow, so blood flow is restricted and there's a lack of oxygen to the heart muscle. This can result in a heart attack. Cardiovascular disease can be treated in a few different ways. Stents are wire mesh tubes that can be inserted inside arteries to widen them and keep them open. They are particularly useful in people with coronary heart disease. Stents keep the coronary artery open, making sure blood can pass through to the heart muscle. This keeps the person's heart beating and the person alive. Stents are a way of lowering the risk of a heart attack in people with coronary heart disease. They are effective for a long time, and the recovery time from the surgery is relatively quick. There is a risk of complications during the operation, for example a heart attack, and a risk of infection from surgery. There's also the risk of patients developing a blood clot near the stent. This is called thrombosis. Statins are drugs that can reduce the amount of bad cholesterol present in the bloodstream. Cholesterol is an essential lipid that your body produces and needs to function properly. However, too much of a certain type of cholesterol, known as bad or LDL cholesterol, can cause health problems. Having too much of this bad cholesterol in the bloodstream can cause fatty deposits to form inside the arteries, which can lead to coronary heart disease. Taking statins slows down the rate of fatty deposits forming. By reducing the amount of bad cholesterol in the blood, statins can reduce the risk of strokes, coronary heart disease, and heart attacks. As well as reducing the amount of bad cholesterol, statins can increase the amount of beneficial cholesterol, known as good or HDL cholesterol, in your bloodstream. This type can remove bad cholesterol from the blood. Some studies suggest that statins may also help prevent some other diseases. Statins are a long-term drug that must be taken regularly. There's a risk that someone could forget to take them. Also, statins can sometimes cause negative side effects, for example headaches. Some of these side effects can be serious, like kidney failure, liver damage, and memory loss. Another disadvantage is that the effect of statins isn't instant. It takes time for their effect to kick in. If a patient has heart failure, doctors may perform a heart transplant or heart and lung transplant if the lungs are also diseased, using donor organs from people who have recently died. However, if donor organs aren't available right away or they're not the best option, doctors may fit an artificial heart. Artificial hearts are mechanical devices that pump blood for a person whose own heart has failed. They're usually used as a temporary fix to keep a person alive until a donor heart, a replacement heart from another person, can be found, or to help the person recover by allowing the heart to rest and heal. In some cases, they're used as a permanent fix, which reduces the need for a donor heart. The main advantage of artificial hearts is that they're less likely to be rejected by the body's immune system. This is because they're made from metal and plastic, so the body doesn't recognize them as foreign and attack in the same way it would do with living tissue. Surgery to fit an artificial heart, as with transplant surgery, can lead to bleeding and infection. Also, artificial hearts don't work as well as healthy natural ones. Parts of the heart could wear out or the electric motor could fail. Blood doesn't flow through artificial hearts as smoothly as through natural hearts either, which can cause blood clots and lead to strokes, a problem caused when the blood supply to part of the brain is cut off. A patient receiving an artificial heart has to take drugs to thin their blood and make sure clots don't occur. This can cause problems with bleeding if they're hurt in accidents because their blood can't clot normally to heal wounds. Also, having an artificial heart in the body, and any battery and controller that might be inserted as well, may be uncomfortable for the patient. The valves in the heart can be damaged or weakened by heart attacks, infection, or old age. The damage may cause the valve tissue to stiffen, so it won't open properly. Or a valve may become leaky, allowing blood to flow in both directions rather than just forward. This means that blood doesn't circulate as effectively as normal. Severe valve damage can be treated by replacing the valve. Replacement valves can be ones taken from humans or other mammals like cows or pigs. These are biological valves. Or they can be man-made. These are mechanical valves. Replacing a valve is much less drastic than a whole heart transplant, but fitting artificial valves is still major surgery and there can still be problems with blood clots. When someone loses a lot of blood in an accident, their heart can still pump the remaining red blood cells around to get oxygen to their organs, as long as the volume of their blood can be topped up. Artificial blood is a blood substitute, like a salt solution, which is used to replace the lost volume of blood. It's safe if no air bubbles get into the blood, and can keep people alive even if they lose 2/3 of their red blood cells. This may give the patient enough time to produce new blood cells. If not, the patient will need a blood transfusion. Ideally, an artificial blood product would replace the function of the lost red blood cells, so that there's no need for a blood transfusion. Scientists are currently working on products that can do this. Now that you have recapped all of this information, go back to Google Classroom and answer the question that has been attached to this video.